This child is one in thousands. He's among the few receiving medical attention at a hospital. Years of neglect and now the war has devastated Yemen's healthcare system. Al Sadaqa Hospital in the southern port city of Aden is operating beyond capacity and it's struggling.
This hospital is the central medical facility providing services to the central and southern provinces of Yemen. We are short of IV solutions and medicines, but the lack of oxygen remains the main problem. If an incubator runs out of oxygen, the baby inside can die.
The war has also forced out medical staff, including a large number of doctors, nurses and technicians. But the struggling health services in Aden are markedly better than other parts of Yemen.
As you see, the emergency units are packed with patients. Many of the residents here are not well off and cannot afford private healthcare services. If you walk around the wards, you will get a clear picture of the situation here in this facility.
Children remain the worst affected in the conflict. A battered economy has left parents with less money, meaning less food for children and reduced ability to bring them to health centers. Fewer vaccinations result in children dying of preventable diseases. The UN estimates 10,000 toddlers under 5 could die as indirect result of the war.
There are about 370,000 children under the age of 5 who are now severely acutely malnourished. And that is a huge risk for their health. They are more likely to die from diseases, 10 times more likely than another child to die from diseases. It also risks to impact their long-term development.
A blockade on imports is causing fuel shortages, which is needed to power generators for electricity. And the cost of fuel has shot up to 5 times. Doctors Without Borders says people in the capital, Sana'a, have a hard time accessing healthcare.
There are no clinics or health service centers. Also, the roads are damaged.
And as all sides focus more on buying guns and ammunition, Yemen's sick and wounded continue to struggle. Osama Bin Javaid, Al Jazeera.